Good morning, and welcome to our second installment of our client education series, Ask the Vet. I'm Dr. Philip DeShield, and today I'll be talking about immunizations or vaccinations, giving you brief information for your viewing pleasure. So we'll start with the fundamentals, so the basic question of what is a vaccine. So a vaccine is a biologic, and it is used to prevent disease. So there are two main concepts here that we'll kind of break down. The first term is biologic, and a biologic just means that it was made from a living organism. So this is different from other medications like Tylenol, aspirin, or Benadryl, which are just chemical structures. So a biologic as a vaccine means we're actually injecting a living or part of a living thing into the pet. The other key concept that a lot of people forget is that a vaccine is used to prevent disease. So it stimulates the body's immune system before the infection. So giving a vaccine on a sick animal can actually make your pet worse and can actually be fatal. So we have to get the idea that the vaccine will prevent disease rather than cure a disease. So why do we vaccinate? Why are we injecting this bacteria or virus into our beloved pets? There are two main reasons. The first is to help the individual. So we vaccinate to prevent unwanted disease where possible. So giving a vaccine provides some immunity or disease protection that may be present in the environment. A good example would be, Parvovirus. Giving the parvo vaccine will prevent our puppy from picking up parvovirus. The other concept of vaccination is looking at like herd immunity, that is to help the population. So by vaccinating a large group of animals in a particular area, it reduces the chance of spread of that disease. So we kind of control the disease in a larger population. This is seen often with livestock, but we can see it in our puppies in the city. If 80% of the dogs are vaccinated, then the chance of picking up the disease is quite low, especially with the rabies virus. So there's a lot of public health campaigns to vaccinate dogs against rabies, so we reduce the prevalence or the occurrence of rabies in the country. We can't forget that no vaccine is 100% protective and 100% risk-free. So with medicine, there's always risks, and we weigh the benefits versus the risks. The vaccines that we use have very high protective factors, so they're very efficacious, but sometimes you can get a little vaccine reaction. The most common would be a little swelling on the neck that can be there 2 to 3 weeks, but that will go away. Sometimes puppies might have a mild fever for the day. Other more severe reactions might be swelling of the muzzle. If you see any reactions like that, contact the vet that administered the vaccine so we can treat appropriately. So we choose to vaccinate based on the susceptibility, so the chance of the puppy picking up the disease or the adult dog of picking up the disease versus the risk of administering the vaccine. So a very sick animal would be very risky to give the vaccine, so we would avoid giving the vaccine in certain cases. So it's always important to have your pet examined to make sure they are healthy and make sure that they are a suitable candidate for a vaccination. So now that we know the importance of vaccines, the question is, when do I vaccinate, or when should I get my pet vaccinated? The three concepts of vaccine timing is we want to vaccinate fairly early, we want to vaccinate on time, and we want to vaccinate consistently. So we vaccinate early. Here at Animal Medical Center, we give the first vaccine between 6 and 8 weeks. By this time, most of the mothers' antibodies that might interfere with the vaccine are out of the system because the puppies have been weaned. And so there's less interference and the vaccine is more effective. Followed by a booster vaccine 3 to 4 weeks after that. We have to give the vaccine within that window to make it most effective. So they get a series of vaccines till they're about 3 or 4 months of age, depending on the dog and the situation. After that, they must get a yearly booster so that we challenge their immune system one more time a year after that vaccine. And in Belize, we give vaccines every year due to the prevalence of leptospirosis and other diseases that can affect them, including rabies. So I mentioned some diseases already, like parvo and rabies, but what are the diseases, or what do we vaccinate for in Belize? So vaccines are generally made for common diseases, deadly diseases, and of course, by nature, they have to be infectious diseases. So in the domestic companion animal population, for dogs, we give the 5 or 6-in-1. So this includes Parvovirus, Distemper Virus, Adenovirus, Parainfluenza, Leptospirosis, which is a bacteria, and then Coronavirus. So Coronavirus is the difference between what people will say a 6-in-1 versus a 5-in-1. So it's kind of an optional vaccine that's based on risk. And of course, all mammals are susceptible to rabies, and so dogs must get vaccinated for rabies, and that's always a separate vaccine. In the case of cats, rabies is also given, but the other 4 or 3 diseases would be the Herpesvirus, Panleukopenia virus, the Calicivirus, and the Chlamydia bacteria, and that is another optional one, the Chlamydia, similar to the coronavirus. So in Belize, it is mandated by law to get your dog and cat vaccinated for rabies. So we have a mandate to do that, and that is done every year. So I will now go over some of these diseases that we vaccinate for quite briefly, so we have an idea of what we're protecting our animals against. The first one that I think many people are familiar with, or somewhat familiar, is rabies, and it's a very important disease. So this should be on everyone's radar, because people can get it, and it's almost always fatal if you get it. So the disease sometimes is forgotten or dismissed, but that's partially due to the robust vaccinations that are given throughout the country. So an effective vaccine program hopefully makes a disease obsolete, like we're looking at, polio or with smallpox. So we have to stay vigilant with vaccinating. So all animals can get this, or all mammals, I should say, can get rabies. So this includes livestock and domestic animals, as well as wildlife. So the law, as I said, requires your dog to be vaccinated for rabies because it is a public health risk. So if a dog bites someone, which all dog bites need to be reported to public health so we can track this down, and that dog does have rabies, the person is at risk of picking up rabies, and it is a very deadly and serious disease. So we want to get the herd population of all the dogs in Belize protected against rabies so they don't transmit the disease to humans. So in Belize, certain wildlife do carry rabies as well, especially bats. Raccoons and stuff can also carry rabies. So it's important to be careful when you're handling these animals if you're licensed to do so, and we don't recommend having wildlife as pets because they can pose a serious disease risk. So going on to dog diseases, one that a lot of people know is parvovirus, and I like to consider it part of the big 3 disease Belize's we see in Belize. So those big 3 would be parvovirus, leptospirosis, and distemper. So we see a lot of cases of this, and this is why we really push vaccination. So parvo would be one that a lot of people are unfortunately familiar with because it is a puppy killer. So dogs can go down very, very quick. 1-2 days they can die once they're infected with parvovirus. Usually you will see bloody diarrhea and vomiting, so they get very, very dehydrated and very, very anemic, meaning they lose a lot of blood, and that eventually can kill them. What a lot of people don't know is that it's very infectious and it's very resistant to degradation. I like to use coronavirus as an example because people are familiar with it now. But you can easily kill coronavirus on surfaces with a bit of alcohol. It lasts, maybe a couple days max. parvo can last months in the environment, and you need to use 1 to 10 bleach to kill it, and it stays a very long time on organic materials or in the soil or on grass. So you should definitely wait before introducing new puppies to an area where there was parvo. 6 months to a year. I would recommend, because they can pick it up and people wonder, my dog didn't interact with anybody, but the parvovirus stays a long time in the environment. So you have to be vigilant for that. And so this is one that we recommend vaccinating for quite early, so 6 to 8 weeks. The second of the big three is distemper virus. So this is another common disease. We see it affecting a lot of dogs in Belize. It affects multiple systems. So the nervous system, we see twitching or convulsions. It can affect the gastrointestinal system, so diarrhea and vomiting. It can affect the respiratory system, so you see difficulty breathing or discharge from the nose, and it can affect the skin, so you see thickened nose and thickened foot pads. It's very contagious, so it's airborne, and it's very fatal as well. So dogs that do survive it with appropriate treatment and supportive care can still have permanent changes, such as twitching or occasional seizures. So it's something to take into consideration. The last of the big three is leptospirosis, and it's a bacteria, not a virus like the other diseases that we vaccinate for. It's important to know that rats are the reservoir species, so that means rats tend to carry it and shed it a lot. It is a zoonotic disease. That means it can be transmitted from animals to humans. Most humans will get it from the rats rather than their pets, but the pets can still transmit it to people. The most common signs would be icterus or jaundice, so that's like yellowing of the skin, yellowing of the eyes. Often they don't want to eat, they tend to bleed easy, and they can have diarrhea and vomiting. This is also a highly fatal disease, and it can cause multiple organ damage. So now we'll talk about some less common diseases that are less severe, but we still vaccinate for because they can cause quite a bit of illness. The first being hepatitis or adenovirus. This affects the respiratory tract, so you get some sore throat. They can bleed a bit easy. They do have a characteristic sign that some dogs will have, which is a blueness in the eye. That's just fluid building up in the cornea. This disease can be shed for several months, including 9 months after infection. Another disease would be the parainfluenza virus. So this is a part of the kennel cough complex. So kennel cough is a series of bacteria and viruses that can affect the throat that cause a harsh, dry cough. So this is a respiratory virus, and it can cause coughing, fever, and tiredness or lethargy. We see it a lot in dogs that are grouped together. So if you have multiple dogs in the same house or in a kennel, it can be transmitted quite easily. And now coronavirus. So a lot of people are talking about this. So this is a different kind of coronavirus. So this is a group 1 coronavirus. So there's, as you can see in this chart, there's so many different types of coronaviruses out there, just to kind of add some clarification. This one tends to affect mostly the intestines rather than the respiratory system. So in dogs, we will see diarrhea and vomiting. It can look a lot like parvovirus, and we can see this affect dogs that have parvovirus already, and it makes the disease much more severe. The prevalence of this in Belize is kind of unknown because we don't have much of the testing capabilities, but sometimes we will vaccinate as a precaution with this vaccine. Okay, now on to cat vaccines. We can't neglect our furry feline friends. Most of the feline diseases affect the respiratory system. The first and the most common one would be the Herpesvirus. So this is also called feline viral rhinotracheitis. So it's a virus that affects the eyes and the nose. Usually you'll see discharge from the eyes. They get a little bit of pink eye and crustiness around the eye and around the nose. We see it a lot in kittens, and it has been linked to stress. Similar to, I guess, with people with herpes virus, you can get like cold sores on the lip when they're stressed, when the body is stressed. So similarly, this can flare up in a cat's life whenever they undergo a stressful period. Another major disease affecting kittens, especially, is the feline panleukopenia virus, which is just a big word for, all blood cell lines are low. So this disease really lowers the immune system, and it's very contagious. and it's prevalent everywhere in the environment, so they can pick it up from all over. So it affects the bone marrow, the intestines, it affects the developing fetus. So kittens can be born with kind of like a small brain and have a lot of defects, not able to walk well. It can cause abortions and all of that. And we do see it more often in younger cats. So this is why it's important to vaccinate young cats around 6 to 8 weeks as well. So the third disease for cats we'll talk about is Calicivirus. So this is very similar to the herpes virus in that it affects the upper respiratory tract. It's a bit more severe than the herpes virus, and we do see more ulcers develop on the tongue, so it can be more painful than the herpes, so cats will often not eat. It's also very contagious, and it's common in shelters or where there's a lot of cats that can transmit it from cat to cat or multi-cat households. So the last disease that we vaccinate for that I'll talk about is the chlamydia. So this is chlamydia bacteria. So this is not a virus, but it can co-infect cats with other viruses. So we see with herpes or with calicivirus, it can cause a very nasty like pink eye, which can lead to ulcers on the eye that can be a pain to treat. So it's good to get diagnosed early. And it can spread to the upper respiratory tract, and then it becomes quite severe because sometimes the bacteria, just like in humans, can be hard to treat. So thank you for your attention. I know it's a lot of information and we kind of went over it quickly. We hope that some of this information will be useful, and we appreciate any feedback on how we can better serve you and your animal family. If you have any questions or concerns or comments about this topic or anything, you can just leave a comment on Facebook, on YouTube. You can text us, WhatsApp us, Instagram. We have an Instagram account as well. So any of those you can send messages, and I'll try to answer as much as possible. Next week, Tuesday, we can have like a live event. So if you have questions at the time, you can tune in and we'll answer it right away. We thank you for joining us. If you have ready to schedule an appointment to see if your pet is ready for a vaccine, you can do so. Just call us here at Animal Medical Center, and we'll be happy to serve you and your furry family. Thanks.